Ignoring a woman on an issue unique to women is blatant disregard, disrespectful, and is despicable. Today, 7 women were standing on the House floor for 2.5 hours and were not allowed to speak on an issue uniquely to women because women can become pregnant. Some women in the Missouri State Capitol today suffer from 2 minorities, party and gender. Not to mention, not one single woman was the co-sponsor of HCR 41. 3 women have recently been silenced in committee hearings. Representative Margot McNeil from St. Louis County for using the word voucher in an education hearing. Representative Jeannie Kirkland from St. Louis County for daring to ask a question in appropriations for health, mental health, and senior services on blind pensions. And Mary Steele has been publicly chastised for suggesting alternative revenue sources. And now they want to silence the majority of women in the House like they want to silence the majority of women across the country.
This wasn't the agenda that the Democrats chose to speak about today. This was the agenda of the Republicans, and they chose to talk about women's access to health care and birth control, even though this issue has been litigated in 28 other states around this nation. If they're going to make the decision to have the conversation, then they need to let each of us who cares to speak about that issue step forward. Personally, in this economy, in this environment, I'd rather hear us talking about job creation. But when they set the agenda otherwise, they need to give those people who are representing constituencies that will be affected by this legislation an opportunity to be heard.
Health care for women, particularly contraception. The effect of this will have a large effect on women. There are over 600 hospitals, Catholic hospitals in this country, and 1,400 long-term care facilities that are run by the Catholic Church. That doesn't speak to all the other denominations or the universities, so it affects a large number of women in this country. It costs approximately $600 a year to provide contraception. I recently had a constituent that called and wanted to know what was going on, if there was a war against women. She told me that when she was 23, she had already had 6 children. And her doctor told her that she should not have another child. She had to sneak the birth control from her husband because of their being Catholic. We need to provide birth control for women. It is a health care issue, and stop this war on women. Thank you.
I'm State Representative Stacy Newman from St. Louis County. What you saw this morning and this afternoon on HJR 41 was complete political theater. It was an anti-woman agenda that has been set by the majority party, in which you can see we had little voice. I was one of the 7 who stood at the mic for over 2 hours, both this morning and this afternoon, with full recognition from the acting speaker who refused to call on us and allow us to use our mics. This is clearly an anti-woman agenda that continues. 98% of women, both Catholic and otherwise, across the country, across our state, use some form of birth control. This is 2012. Birth control has been legal since 1960. This is a non-issue. Women are listening. They're listening to this anti-women agenda in almost every bill that we're carrying. And we 7 women, along with the rest of our minority caucus, men too, are not going to silence our voices. We're going to continue to speak out in committee. We're going to continue to speak out on the floor. And if we have to come outside the Capitol on the grass to talk to you, we will.